Good afternoon. Good afternoon. Okay. All right, ladies and gentlemen. Good afternoon. Professor Patrick Singh, Chief Dental Officer. Professor Lim Shui Hui, Master, Academy of Medicine. Distinguished guests, ladies and gentlemen. Welcome to the launch of the very first Dental Academy of Medicine MOH Clinical Practice Guideline. And the topic that we have chosen for this very first guideline is on dental implants. Later on, I'll go through with you how we go through the process of selecting a topic for this clinical practice guideline. It's gone through, it's actually almost like 3 years in gestation. And why we choose this topic is really that there's a lot of variation in practice out there, and dental implant, the practice of dental implant dentistry has gone through many changes over the years from the times Gosser Larsen, the very first dental implant patients of Brennemark, first had his implant in 1965. So from then to now, we have gone from uploading a protocol of like placing implants in, following a very strict protocol of aseptic technique, waiting enough time for osseointegration to take place, to what we have now as an immediate loading, and different people doing at different times, different people using different types of implants. And we thought that it's important as a college to look into what the evidence really shows us and share that with the dental community and to the patients at large as well. For today, we have chosen some of these topics. It's not comprehensive, and it's just a sampling of the topics that we have worked out in the clinical practice guideline. And later on, at the end of the day, we can have a question and answer session, and you don't need to limit yourself to just what is presented today. If you have any questions about the other questions or the other topics that's addressed in the guideline, feel free to ask them. All right. So without much further ado, let me invite Professor Patrick Singh, our guest of honor today, to give us his opening address. Professor Singh.